Welcome back. My next guest is Dr. Stephen Umansky, who is an orthopedic surgeon with the Lexington Clinic, and your specialty is hand. What do you do with a hand?
Well, there's a lot you can do. It's called a hand surgeon. It's a subset of orthopedic surgery in my practice, and it involves injuries, conditions that happen to the soft tissue, bone, and joints of the hand, wrist, and elbow. So there's quite a bit in there that you can have injuries and problems with. So,
now, I mentioned the thumb when we started the show, and you don't realize how much you use your thumb until your thumb starts to hurt. What are some causes of pain there?
Well, pain in the thumb can come from a lot of things. Of course, you could have an injury, as we talked about. You could have a little tendinitis, but the real thing that I'm seeing a lot of now, especially as people are starting to get outside and start doing some more yard work and lawn work and things like that, is pain at the base of the thumb due to arthritis at the base of the thumb. It's really common, and it can start at the age of 40, so at a younger age than most types of arthritis. And it is just a really nagging pain that occurs right through here, through the small muscles called the thenar muscles of the hand, as well as just kind of radiating up to the thumb.
So if you've got arthritis, we're going to talk about the surgical. Now, we might go back and talk some simpler stuff first.
Sure.
Let's talk about the new procedure, because you're one of the few people who are doing this. And tell us about it. It started in Europe?
Yeah. This operation, it's a replacement of the thumb carpal metacarpal joint, which is in English the joint where the thumb meets the wrist. So that joint has had multiple different operations that have worked pretty well for it over many years. There's one that we do now that has been around for about 70 years, where you actually remove the wrist bone that the thumb meets with to avoid the two bones with no cartilage grinding together, which is really the essence of arthritis. Well, in Europe, they've had a joint replacement, a full joint replacement. It actually looks like a hip replacement that has a little stem that goes into the thumb and a little conical socket that goes into the wrist bone that creates a joint that is smooth and can move without those bones grinding together.
Well, now, you brought one with you. We're going to try to get a picture of it here. If you pick it up there and show it,
Sure.
it looks, to me, it looks like it does look like a miniature hip joint.
Yeah, it goes in upside down.
Focus
so
in,
right there.
Focus in on it there.
But it is a stem with a little ball right here that's made out of plastic and a little socket that's a highly polished metal. And these get implanted into the bones of your thumb and wrist and allow for free, smooth movement between the parts that then helps you function with better strength and less pain.
Okay. And you are one of the few people, or I guess the only people in this area.
The only one at this time in Lexington, yes. This was a decision that the company made early on when they got their FDA approval, that they were going to roll this device out slowly so they can keep a close eye and make sure that people are putting it into the high standards that they've had over the past 15 to 20 years in Europe. So it was by invitation only, and we had to go to Europe, France, and Geneva, Switzerland, in order to train.
Okay. Now, is there certain people who are candidates for this, and are there risk factors with this?
There's risk factors with any surgery, and with joint replacements in particular, the risk factors that you're most concerned with are infection, loosening or wearing out of the joint, as well as dislocation of the joint. But fortunately, in the studies that we've seen for the past 15 to 20 years in Europe, those are very rare.
Okay, now, let's back up. If you don't need the surgery, are there some things that you do before you get to that point?
Absolutely, and not everybody that has arthritis needs surgery. Most of the time, you can get early signs and symptoms of the pain under control by wearing a small brace or a splint, or just stopping what you're doing for a little while and letting the joint rest. Between letting the joint rest or wearing a splint or a brace, a lot of times people can have good quality of life and not need anything else. Arthritis pain tends to wax and wane, and so sometimes you'll have pain for a while and then it won't bother you for a very long period of time, a period of months or sometimes even years. If that doesn't work, sometimes the judicious use of a steroid injection into the joint can be helpful to cut down on some of the inflammation in the joint and decrease some of the pain that people are experiencing. If it gets to the point where it's really affecting people's quality of life, and what I tell them is to know if you're ready for a joint replacement. It's one of those things that you know as a patient, and I might not know as a doctor, but I tell people when they wake up in the morning and say, I just can't live like this anymore, that's the time to start thinking about joint replacement.
That's the time to come see you.
I can see them earlier. I can see people and give people guidance on treatment and help with the diagnosis right from the first sign of pain, and we can guide you down this pathway of minimal treatment, splinting, simply reassuring you that what you have is not dangerous. But we're here to help with any problems, conditions you can have with the hand, wrist, or elbow.
Thanks for coming in. Thanks for all the work you do.
Thank you.